there, welcome to Damie RX Care channel, where we learn a lot about medications and how to use them properly. Make sure if you're not subscribed to our channel, make sure you hit your like and your subscribe button if you do enjoy this video and you like to be alerted anytime we post new educating content.
Okay, so right on to today's topic. So today we're going to be talking about constipation. So I do get a lot of questions from my patient about what to use for constipation, whether it is I don't feel it coming or it won't come out. Abby, what am I supposed to do? So for those questions, if you do have similar questions to that, then you probably want to stay tuned and learn more about what to use or what to take over the counter for this condition. All right, so there are two kinds of medications that patients normally take for constipation, which is one, your stool softener, and two, your laxatives. So if you don't feel it coming, then you need to take a laxative. Okay, so I don't feel it coming, laxative. If it won't come out, then you need a stool softener, okay? So both those things you need to remember when you're choosing something to use for constipation over the counter. So there are different type of laxative that you can use, which is, don't forget, if you don't feel it coming, you need to take a laxative, okay? So there are two types of laxative. We have the fiber type of laxative, and we also have the fluid type of laxative. So the fiber type of laxative, those are the laxatives that kind of help you add more content to your stool so you're able to go right away, okay? And the fluid type are the ones that add more fluid in order to help you go. So the fluid type are more faster. You are going to go within hours, and the fiber type, those still take kind of like a 6, 8 hour or a 12 hour or 24 hour period for it to work. So the fluid type, remember, those are the ones that you take if you're trying to go as soon as possible. And the fiber type are just to help you keep regular. If you're the type of person that you want to be able to go, every morning or every 2 days, or how regular you want to be able to go would depend on how much you're using the fiber type of laxative, okay? So first, we're going to be talking about the fiber type of laxative. Fiber type of laxative, those are like your Metamucil that has fiber in it, so it's going to help you add more bulk to your stool so you're able to go in the next couple of hours. And another one is FiberCon. So remember I said Metamucil and FiberCon. And another ones are your Benefiber and your Citracel. So those are going to be on the laxative or your digestive health aisle if you're in the pharmacy, okay? So all these medications, usually you have to mix them with a cup of water and you just kind of drink it. Most patients, I would tell to drink it the night before so they're able to go the next morning when they wake up. All right, and the fluid type is the one that work within minutes to hours, which is going to add more fluid to your stool in order to help it go slowly all the way down to your rectum and down out into your anus and out into the toilet, okay? So these are going to be your milk of magnesia, your Miralax, or your Flit Enema. So there are some pros and cons to both medications, so you want to stay tuned so you can learn more about it. All right, so for your fiber laxative, like I said, those are the ones that add more bulk, your Metamucil, FiberCon, Benefiber, as well as Citracel. And these, you want to make sure you're drinking plenty of water with that. So remember I said usually they're in powder form and you usually have to mix them with a cup of water in order to help you go. So these are not immediate effects. So you won't be able to be running into the bathroom anytime soon. So these kind of, like I said, you use it the night before and usually the next day you're able to go with ease, okay? And some of the side effects of this medication for the fiber ones are going to be gas or bloating. So it can cause some gas and bloating if you're not, if you're not going the next day when you wake up. And also you want to make sure you're drinking a lot of water with this. So for people that don't really like water, it's probably not your best option because, like I said, you still need some fluid in order to help that stool go all the way down to to the last part of your body in order for them to be dumped inside the toilet. Okay, so, and also for some patients, they might be on a fluid restricted diet, so you can't really drink too much water. These are patients who generally have like some type of swelling as a result of like heart failure. So usually they would not recommend this medication, like I said earlier, because they have to watch out for the right, the amount of water that they drink. And moving on to the fluid laxative, like I said, which are the milk of magnesia, Miralax, as well as the fleet enema. These ones are the immediate effect ones. So this one will make you go, okay? You will be running to the bathroom in the next like 1 hour or 2 hours, okay? So, and another side effect of this medication is that if you use too much of it, it can cause diarrhea. So you don't want to go from being constipated to, having diarrhea. So you want to use it to the minimal and make sure that you're taking the right amount so you're able to go, as well as not causing diarrhea for yourself. All right. So moving on, we're going to be talking about the stool softener. So these are the ones that you use if it won't come out. Like you feel it in there, it's in there, but you're having trouble getting it out. So these are your stool softener, like I said earlier. So you want to kind of, so how the stool softener works is it kind of helps soften your stool so you're able to go, just like, the name of it says. So a popular stool softener is a Docusate. So Docusate sodium is the popular stool softener that, people commonly use. Another name for this, the brand name is Colace. So that would help you kind of soften your stool so you're able to go. So the stool softener is not an immediate effect either. So you would not be running into the bathroom anytime like within the next hour or so. That's not how it works. So it's kind of work gradually to kind of help you soften your stool so you're able to go. Usually, most of my patients, they'll usually give them this medication if they're taking like a strong pain medication like a hydrocodone or oxycodone, because usually those kind of medication can make you constipated if you're taking it for a long period of time. So they would call this in to kind of help them soften their stool so they're able to go, so you're not going from being, in pain in one side of your body to having lower back pain because you're not able to use the bathroom because it hurts. Okay? Sometimes it hurts. All right? So what are some side effects that you need to look out for when you're taking Docusate? So it can cause mild dehydration, so you want to make sure you're taking plenty of water, because what it does is the medication absorbs liquid out of your stomach in order to kind of help the stool or the poop spend less time there. So it absorbs liquid to kind of help you kind of, easily pass down the stool to where it needs to go. And another medication that people use that also comes with the stool softener, or you can use it by itself, is called a stimulant medication. So it kind of helps stimulate your nerves to kind of increase movement in your stomach so your stool is able to pass down and go where it needs to go. So the stimulant laxative is going to be like your Senna. So that usually help, and it's with an immediate effect. So the stimulant works like magic. So usually they'll have it with the stool softener, or they'll have it by itself, and that would help you go within, the next hour or two. And like I said, with these medications that cause immediate effect, you don't want to take too much, because then you go from having constipation to having diarrhea. Okay? All right. So what are some ways that you can improve your bowel habits without having to take a medication? It'd be nice if you don't have to go spend an extra cash, in the pharmacy in order to, buy a medication that would help you use the bathroom. So what are some ways that could help with that? So we'll be discussing that. So first thing first, you want to make sure you're increasing your regular dietary fiber. So you want to make sure that you're eating fiber-full foods. So we have for instance, we have your beans, you have your oatmeals, you have your whole wheat bread. So these are the medication that you want to make sure that you're incorporating in your food. Another food that, can also help is brown rice, fruits as well, like berries, your nuts, like almonds, pecans, and walnuts. Those can help you go as well. So you want to make sure that you're adding those to your diet. In most times, when, like, for the food that I mentioned earlier, like beans, wheat bread, oats, brown rice, like they always say, making sure you're also keeping it to, the adequate amount, making sure you're not taking, too much of those, especially in our patients that have diabetes. You can't have, too much carbs. So you want to make sure that you're taking this, the adequate amount, okay? And also you want to make sure that you're increasing the fluid intake whenever you're eating any food, making sure you're drinking at least 8 ounces of water a day. Sometimes you just want to drink a little bit, something a little bit tasty, which isn't bad sometimes, but making sure that you're still drinking plenty of water, because water is essential for your body, okay? You want to make sure you're drinking water, you're staying hydrated. Another bowel habits that you need to incorporate is exercise. I know for me, when I'm constipated or I'm not able to go, when I exercise, it usually helps a lot, because then I'm able to use the bathroom, after a good workout session, which sometimes is not the case if I'm not constipated. But if I'm constipated, of course, it usually helps. All right. And also making sure you're decreasing your caffeinated foods, like your alcoholic beverages, spicy food, fatty foods as well, that can cause constipation. And also a big tip. If you are going to use a stool softener, make sure that you're not using it for more than 7 days. You don't want to use a stool softener for more than 7 days. Ma'am, are you listening? No more than 7 days, okay? You don't want to go from having constipation to diarrhea. All right, so that'll be all for today. I hope you guys were able to enjoy this video as much as I did, or even more if you actually do need to use the bathroom. But yeah, go buy that medication if you're not able to get something right away to help you go. Like I said, exercise and making sure that you're incorporating those healthy habits in there. So I hope to see you next time. Make sure you hit like and subscribe if this video really helped in finding what to do for your constipation. Okay? All right. Thank you, and stay tuned.